collaboration with the Cyprus Mail, this is the Cyprus News Digest with Rosie Haralambous.
This week, as the coronavirus lockdown continues, we'll find out about the 6 pillars of lifestyle medicine. They will help you with your enforced incarceration, with ideas of how to make the most of the time you're having to spend at home, and how to keep healthy in the process by looking after your mental and physical well-being.
Actual physical exercise, which is so important for your health. In reality, physical activity can improve your long-term risks of things such as heart disease and diabetes. It can also help decrease stress. And number 3, it can also improve the way that you sleep and the quality of the sleep that you get. And number 4, it can actually help treat things such as depression and mood. So physical activity is crucial, and that intentional physical activity, let's say I decide I'm going to try to do an online aerobics class for 20 minutes for 3 days this week, just to get more exercise. So making a simple plan of how you can be less inactive and more physically active will be helpful in the long term, but also be helpful during the social isolation.
On last week's programme, you will have heard us talking to somebody who's spending 14 days locked in a hotel room in quarantine. When we talked to Maria Miles, I asked her several times about how she was coping, and particularly with her mental health, just being on her own for 14 days. She was coping remarkably well, but she might be interested, since she's still got another day to go, in listening to my next guest. She is Maria Cecilia Mosquera, who is Clinical Assistant Professor at the Department of Primary Care and Population Health at the University of Nicosia Medical School. And she specialises in lifestyle medicine, which is something you may not have heard about, but I think you will be hearing a lot more about while the coronavirus pandemic continues. Maria, thank you very much indeed for joining us. Maybe first you could explain to us what lifestyle medicine is, and I think it's per the American College of Lifestyle Medicine's basic approach, isn't it?
Yes, thank you for having me today. Lifestyle medicine is part of the American Board of Lifestyle Medicine, but there's also an international board of lifestyle medicine, so this is rather an international definition. It is an evidence-based approach, so we focus on using what evidence there is in science to prevent, treat, and reverse diseases, and the focus is on replacing unhealthy behaviors with positive behaviors. It has 6 different parts or pillars. The first one is what we would call nutrition, so eating healthfully. The second one is physical activity, so being physically active. The third one is based on stress management and stress reduction. And the fourth one is on getting adequate sleep. The fifth one is on nurturing your social connections and your relationship. And the 6th one is on avoiding risky substances.
And we should add in here that I think you very recently shared all these tips with the staff and students of the medical school at the University of Nicosia, because they must be going through a really difficult time, particularly the students. I know that exams have been postponed and so on and so forth. That must be really stressful. And you've shared on email with me some of the links that you've shared with them, which I'm hoping to run along the bottom of the programme, on the YouTube programme, so that people can actually see those links. There's a lot of different activities in those links and advice of the sort that you're giving us now.
Absolutely, yes. I mean, these are challenging times for us at the University of Nicosia, our students, our staff, our faculty, but obviously our community, which is why the University of Nicosia on their news page has posted 6 articles, one focusing on each of the 6 pillars of lifestyle medicine, to try to give some tips to our community on what they can do to stay healthy at home during social distancing. But also each one of these articles has links of things that can help. As an example, for physical activity, there are some links to free exercise videos from the NHS and from, for example, the YMCA that you can do for free for physical activity, exercise, strength training, flexibility, etc.
Right, now then, how do you put these things into practice, if you like, particularly for people who are on their own in social distancing situations like we have now? I mean, a lot of lucky people, some may say not lucky, have got some members of their family around them, but there are other people who live alone and have very little contact at all. So it must be quite difficult, isn't it, to sort of get that feeling that, okay, I need to go through all these things and see how I can implement them. So what would you say to them?
First off, it's usually more challenging to tackle everything at the same time. So if you are, say, staying in an apartment by yourself because you're following the rules of social distancing, you might not want to change every aspect of your lifestyle at the same time. So first, make it easy. And so we have something called tackling things with SMART goals, which is you want to make them realistic, you want to make them attainable, and you want to make them trackable. So let's say I live in an apartment by myself and I don't have any physical connection with people because I'm following the rules of isolation. So I want to be able to connect with people socially using social media, telephones, video chatting. So I might make a goal that says, I will work to spend 10 minutes every day with my family via virtual chatting. And that might give me some of the social connection. And so if I say 10 minutes every day for the next week, that makes it realistic, and I have a time-bound period that I can make something easy, achievable, and feel like I can possibly accomplish in this week, while also giving me some of the social connection piece that is vital to our lifestyle and a healthful lifestyle.
Can we go through each of these 6 pillars one by one? Because, for example, eating healthfully, I think most people do know what a healthy diet is, but a lot of people, particularly in situations like this, tend to eat comfort food, don't they?
Absolutely. And when you're at home, sometimes you can lose the structure of what your regular day would have been. Let's say you usually would get out, have your breakfast, go to work, have lunch, come home, have dinner. Now you're spending your entire day at home near the refrigerator, and you might not be sticking to your same schedule. So not only are we potentially leaning to comfort foods because of stress, but we're also losing some of our structure. So one, it can help to think about what your structure was before and whether you can still apply it now. And two, you can actually take this as an opportunity to make positive changes in your in the way that you eat, because, for example, it is well known that eating more fruits and vegetables can actually make an impact on what your mood is even the next day. Let's say today I eat more fruits and vegetables, my mood might be improved or more positive tomorrow. So not only would you be improving your health for the long term, because we know that eating more fruits and vegetables, eating more healthfully prevents things such as diabetes and heart attacks, but in reality it might actually make you feel better in your mood state while you're staying at home in social isolation. So focus on what can you do that's realistic to try to make sure that you're eating more fruits and vegetables. So, as an example, in my house, we have a rule that we have to eat a fruit or vegetable every single meal of the day until we've eaten at least 5 fruits and vegetables today, with the goal of even more. So my daughter knows that if she hasn't eaten at least 5 fruits and vegetables today, if she's asking me for dessert, I will ask her, did you have your fruit and vegetable today, before she's allowed to think about having dessert. So you can make something as simple as that. But the idea is using foods to nourish your body, which is so important in a time like now where we're trying to make sure that our immune system is as strong and is working well as it possibly can be to help fight infections.
And I presume that we ought to maybe also be thinking about the fact that we're probably not taking as much exercise as we would normally.
Absolutely. Some people are taking advantage of the ability to go out to exercise, but many people might actually be sitting at home much more than they usually are. Example, I'm working at home on a computer, and I'm spending much of my time sitting. Inactivity, so sitting and not moving around too much, is a risk factor for health risk and health conditions. So I don't want to be sitting for 4 hours at a time without standing up and stretching and moving. I want to be able to make those breaks, like let's say every half an hour, I stand up and stretch. When I'm on having a phone call for work, I could be walking around instead of sitting. When I take a coffee break or a tea break, you can walk around your living room. And those are simple ways to add activity to your day. That's one piece, the inactivity part. The second piece is actual physical exercise, which is so important for your health. In reality, physical activity can improve your long-term risks of things such as heart disease and diabetes. It can also help decrease stress. And number three, it can also improve the way that you sleep and the quality of the sleep that you get. And number four, it can actually help treat things such as depression and mood. So physical activity is crucial, and that intentional physical activity, let's say I decide I'm going to try to do an online aerobics class for 20 minutes for 3 days this week. Just to get more exercise. So making a simple plan of how you can be less inactive and more physically active will be helpful in the long term, but also be helpful during the social isolation period.
Right, now let's move on to the next pillar, which I think is sleep.
Absolutely. So sleep is crucial to mood and to health. Lack of sleep can lead to higher risk of diabetes, heart disease, obesity, depression. In reality, most adults need about 7 to 8 hours of restorative sleep every night. And many adults are not getting it, especially if you're altering your schedule, going to sleep very late to waking up very early. You might not be getting on average 7 to 8 hours of sleep. So those are the recommended hours of sleep every day. And there's some things that you can do to make your sleep be better. For example, you want to make sure that your bedroom is cool, dark, and quiet. You want to make sure that you're using your bedroom for sleeping and not for other things, like you're not working in your bed. You want to make sure that you schedule worry time. So there are many things to be worried about nowadays, but you want to, before you're going to sleep, maybe have a notepad next to your bed. Where the things that are running around your head, you're thinking about what you have to do tomorrow, you write them down before you go into bed, and that keeps your brain organized, allows you to clear your mind of distractions. And you can also do things like try breathing and relaxation exercises, so meditations and light yoga before bedtime. There are also some things that you shouldn't do before trying to go to bed because it might alter your sleep or sleep quality, such as eat large meals before bedtime or watch TV, play on your iPad about an hour before bedtime, or drink coffee or drink alcohol. Because alcohol, although some people find it makes it easier for them to fall asleep, can affect the quality of your sleep. And although exercise is beneficial in so many ways, you want to make sure that you don't do vigorous exercise within 2 hours of bedtime, that you focus only on light exercises such as yoga.
And a lot of people like to take a warm bath, don't they, before they go to bed?
Yes, a warm bath or a shower can actually be helpful to relax you, and there are some physiological responses in your body that indicate to your body that it's time for bed. So a warm bath, a warm shower is actually a great idea before bedtime, correct?
And obviously that, I presume, applies as well to children. Can we just talk a little bit about children and sleep in these sort of situations? Because they've been cooped up, particularly perhaps in a flat, all day. They're probably not getting the physical activity, however hard their parents try, that they might normally get, which would, in a sense, wear them out and make them ready for sleep. Are there any other strategies in helping your children to get a decent night's sleep?
Absolutely. Besides obviously trying to make sure that they do get physical activity, as an example, it doesn't have to be exercise for exercise sake, but yesterday at my house we had a half-an-hour dance party outside on the veranda. So that can count as activity that can help children wind down before bedtime. But also they should, even though we are in challenging times, you should try to have some structure to their sleep schedule, because if they're going to sleep every day at 1 a.m., let's say, because they're just staying up all night playing on their computer, that can be challenging. So following some of the same recommendations that I've just mentioned can help adults will help children, like making sure that they don't have screens in their bedroom, that their phones and their iPads charge outside of the bedrooms. Ideally, no TVs in the bedroom, although I know that can be challenging to change at this particular time if that's what you have in your home. But also making sure they can participate in things such as relaxation and breathing exercises before bedtime, and focusing to make sure that they don't eat large meals before bedtime. And for adolescents, example, that they're not drinking coffee late into the night or playing on their phones in the evening. sleeping. So the same recommendations that would apply to adults, you can apply to your child. But remember that for children, structure is important, particularly for sleep. Having a regular sleep hour, sleep time to go to sleep and sleep time to wake up can help in the long term make sure that you have good quality sleep.
What's the next pillar?
Yes, and so you mentioned stress, which is one of the other pillars. We know that our students, our community, there are so many reasons to be stressed and worried nowadays, and stress can actually have health effects that we would like to try to prevent. One important thing about this is these are challenging times, but we can take this as an opportunity. Because many of us, on regular days, the months before coronavirus, have been thinking that we're spending too much time at work and not at home, and not enough time with our families if we have family at home. So take the opportunity that's being given to you to focus on things that you wanted to before. And one of the things that's challenging and causing more stress nowadays is the news. Coronavirus is everywhere in the news, so it can be hard to avoid it. And watching too much news about coronavirus can actually leave you feeling anxious or distressed. It's helpful to focus the times of your day when you're looking at the news about coronavirus. So let's say choose a particular time in the morning or the afternoon where you're going to look at the news, and the rest of the day try to avoid it. Second is also try to make sure that you're looking for information from trusted health professionals like the World Health Organization or the University of Nicosia, because there are rumors out there that you want to be able to distinguish from facts, and trusted health professionals can help you with that.
Yeah, the dreaded fake news. There's so much of it going around as well.
Absolutely. So it's hard to know what's true and what's not, which is why sticking to trusted health professionals can help. It's also important to recognize your own feelings and needs and set apart time during the day to do things that you find enjoyable and relaxing. It's an important part of every day. You want to find things like reading, listening to music, looking at art. For example, nowadays there are many museums that have allowed you to follow their exhibitions virtually. So you can go to the British Museum of London with your computer, or you can go to the Guggenheim Museum in New York with your computer. And you can also try things such as meditation. So there are some videos for mindful breathing, as an example from something called Every Mind Matters. There are apps that you can use on your phone if you use technology that allow you to use some tools for stress reduction and mental well-being. And it's important that if you're feeling stressed or distressed, to reach out to your family, to your friends, to colleagues or healthcare professionals. I know that recently the government has announced a hotline for psychological support to the public, and there's some phone numbers where people can reach out if they have mental health needs and need assistance.
And you mentioned technology. I suppose this is a very good chance, isn't it, to actually learn some new technology, especially for the older people, because it will be giving them a new skill, but it will also be passing the time. And the one thing I think that drags when you're stuck at home is, what do I do next? It's only such o'clock.
Absolutely. So not only is it an important opportunity to learn technology, but also so many other things that, a new language, a new way of cooking. There are so many free courses out there that people can take advantage now of. But also from the social connection side, not only is it an opportunity for you to learn new ways of technology, but if you know how to use technology, it's an opportunity for you to teach somebody else virtually how to use it. Let's say you have a family member that you can connect with on social media through a video. You can show them how to use an app or how to install the app.
Or you can do a cooking thing together or something. I mean, there are lots of ways. You've just got to think of new ideas, haven't you?
Absolutely. I have friends that are scheduling, tea time, and there are 10 families scheduling tea time together, or other people that are showing people how to draw using videos or technologies. I saw a grandfather and a grandchild that were having a music lesson electronically, and we're singing together or drawing together. There are so many ways to connect together, but the reality is if you can actually volunteer some of your talents to other people, let's say you're really good at entertaining children, so somebody needs if they're half an hour to be able to concentrate and work, you can volunteer to virtually do a sing-along with the child, play music. And volunteering has some benefits. The helping others can actually help you, the person that's volunteering, of your time.
Right. What else have we got to think about in terms of the 6 pillars of the lifestyle medicine?
Yeah, so social connection is one of the key pieces, and that volunteering piece that I just mentioned is a piece of it. So helping others, assisting the elderly or the vulnerable in your community will actually make you feel a piece of the social connection, which is important to health, but also give you a feeling of accomplishment, which can lead to positive outcomes for health. Also, we've already talked about the connecting online piece, how you can try to start a book club or a film club. That can give you some social connections. For that example that you gave earlier, where let's say you live by yourself in Cyprus and you have nobody else that's here with you. How can you still connect with people? Well, use the virtual platforms to allow yourself to do that, and use the virtual activities. Like I saw that some of the famous dance institutes, for example, the Alvin Ailey Institute in New York, there's an extension that's giving free dance classes throughout the day. So you can connect with people live in a virtual dance class online. Or you can have a virtual science lesson. It's, a reef relief organization. So that's the social connection piece. The last piece of the 6 pillars that we're talking about in lifestyle medicine is avoiding risky substances, which is crucial during this time period when so many people are concerned, stressed, worried about their health, the health of their loved ones. Many people turn to things such as alcohol or can turn to smoking and other drugs as a form of escape. But really, the escape that they might feel is temporary, and we know that it leads to so many health outcomes because of things such as drug addiction. And we know that smoking, drinking excessive alcohol can lead to things such as cancer or heart disease. So it's important to remember that during this time, there are positive things that you can turn to instead of these risky substances, such as exercise, which we mentioned, music, dance. And it's important to make sure that you get enough sleep because you might be making unhealthy choices if you're having lack of sleep and not enough sleep. You can use things such as mindfulness, meditation, breathing exercises to cope with stress rather than using risky substances. And in reality, you might take advantage of this time. Maybe this is actually your opportunity to quit smoking if you're already smoking. And there are many tools to help you do that, virtual tools such as apps. But there are also tools such as smokefree.gov that give you a concrete plan. There's a six-step plan that you can follow to be able to help you make a successful plan to quit smoking.
I am a smoker, and I would suggest to you that when the stress levels are as they are at the moment, that's probably the worst time to give up smoking.
Right? It can be very challenging, but if you were motivated and already thinking about stopping smoking, for some people this will be the right time. So part of making a successful smoking quit plan is picking the right time to do so. So you're absolutely right, which is why with lifestyle medicine, you want to try to think of something positive that you can exchange for. So example, maybe quitting smoking might be challenging, but potentially exchanging the 1 cigarette you smoke a day with some exercise time might be a way that you might decrease the amount that you smoke and decrease your health of smokes. And that's why setting SMART goals can be so important because you want to set something that's realistic for you.
It does sound to me from what you've been saying that lifestyle medicine is in a sense a holistic approach to healthy living because all of these 6 pillars are somehow connected.
Right, and these are not new areas. Many of these are things that all of us have heard about are good for our health. But the idea is exactly that all these areas are connected and together they can help to give us the more helpful lifestyle that we're seeking. So the goal is to support each individual in making sure that their lifestyle has optimal health for them. And using the evidence that we have about these healthful activities to try to support that.
A final word, if you will, Maria, if you can sum it up very briefly, the attitude people should take to what is a very challenging time, I think, for everyone. You've got people who are on their own, you've got other people who have family who are on their own, but they're not allowed to go and visit them, and so on and so forth. And I would think maybe that the right attitude to looking at how you can get through this and help others to get through it is probably going to make it successful or not.
You're absolutely right. You know, one of the key ways to think about this new time of social distancing is to think about it in a positive way. What we're doing affects the health of society. We might actually be preventing somebody from dying by staying home, but also think about all the things that you can do in your home, not what you can't do. So positive psychology leads us to things such as writing a gratitude journal. So every day, writing one thing that you're grateful for today. We're focusing on what you accomplished today as opposed to what you were not able to do. Focus on practicing acts of kindness and doing things that are meaningful, such as volunteering to help others virtually, sending somebody a kind message today. All of these things help us create happiness for ourselves in the present, which will lead to a healthful lifestyle and a helpful future.
And I think that on the University of Nicosia news page on the medical school, all of the links that we've included some of in this programme, but obviously couldn't do them all, they're all down there. So remind us, if you will, of the URL.
Yes, so if you go to www.unic.ac.cy, that's the main University of Nicosia webpage. And there's a news tab there that will lead you to find the 6 links to the tips for a healthful lifestyle. In addition, if you look up on Facebook or Instagram, the University of Nicosia has also posted each one of these on the links there.
Maria Cecilia Mosquera, thank you very much indeed for joining us. She is Clinical Assistant Professor at the Department of Primary Care and Population Health at the University of Nicosia Medical School. Many thanks.
Thank you very much, and I wish all of you to stay well. Thank you so much.
You can subscribe to the Cyprus News Digest on iTunes for free and get the program downloaded to your phone or tablet so you can listen anytime, anywhere.
In collaboration with the Cyprus Mail, this is the Cyprus News Digest with Rosie Haralambous.
The biggest achievement of Crime Stoppers has been the ability of the public to be able to give information about crime anonymously.
There's no way I could have kept prostituting without the drugs. There's no way I could have had my body used like a public toilet, because that's actually what prostitution is.
And then the 4th series I started 3 days after I'd won the Oscar, so the whole of the Monarch of the Glen experience was all interplatted with the Gosford Park Oscar experience.
I was working with Ronnie James Dio, and David was going to reform Whitesnake in 2003.
Cyprus was chosen because Cyprus is a stable, peaceful and secure place.
We have to really look closely. What are we doing with children? What are we doing with adolescents? And what are we doing with adults that can help them move into a more literate situation?
The ones that I'm proudest of are the ones that were true discoveries, where we found something we didn't know existed.
If you were with us a couple of weeks ago, you'll have heard us talking about the Cyprus Symphony Orchestra streaming concerts. Well, the next one is coming up tomorrow, Saturday the 4th of April at 7 in the evening. This concert will be presenting 3 musical stories for the whole family, but especially for the youngsters. It's recounted by a double bass, a violin and a narrator. The concert will also include projections of illustrations, and the narration will be in Greek. So that is the Cyprus Symphony Orchestra, a giant, a bull, a hare and a turtle, in concert on their Facebook page on Saturday the 4th of April at 7 p.m. Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.